Namaskar. My name is Swamy Raj Vibhu. And I'm also working in this ecosystem of fertility. अच्छा, कितने लोग यहाँ पे जो हैं उन्होंने ऑपरेशन सिंदूर को फॉलो किया? Has anybody followed ऑपरेशन सिंदूर? अच्छा, उसकी सबसे इंपॉर्टेंट चीज क्या थी मालूम है? We use ब्रह्मोस better than रशिया. रशिया से बेटर हमने ब्रह्मोस को यूज किया. We used our defense umbrella better than Israel. और ये बात मैं आपको क्यों बता रहा हूं? Because I want India practice of IVF to be better than any other place in the world. Can we achieve that? क्या उसको अचीव कर सकते हैं? How? What is the missing element in it? I'll just try to explore that missing element. अगर उसको आप लेके आ गए, then India practice of IVF can be much better than any other place in the world. So how? कैसे वो कर सकते हैं? So assisted reproductive ecosystem में आप जब assistance कहते हैं, when you say assistance, what does it mean? The body is somewhere disabled, isn't it? तभी आप assistant का use करें. The body is becoming disabled. What does it mean? The fertility of the human body is going down day by day. And you know that. आपको मालूम है. So, reducing AMH count, endometriosis episodes, hormonal imbalances, PCOD cases, वो सब आपने देख लिए, है ना? So, my question is, on one hand, we are enhancing or improving the assistance. The missing part is, can we improve the AMH levels, hormonal levels, reduce the episodes of PCOD, thyroid? क्या ऐसा काम हम कर सकते हैं? If you do that, we can increase the efficiency of IVF from 2% to more than 60%. आप में से कितने लोग चाहेंगे ये? Number of IVF cycle can be reduced drastically. कितने लोग चाहेंगे? मेरे ख्याल से सभी चाहेंगे, क्योंकि in any scenario of the fertility of this world will not go up soon. तो केसेस तो बढ़ने ही वाला है. But the reputation of conception, giving conception with less number of IVF will make us pioneers in the world. And that is what we have achieved. We can improve and increase the AMH count of, in our program, it gets increased in most of the women. Probably we are the only program which focuses on increasing the AMH count. We have seen even the genetic defect, chromosomal defect, can be corrected, and we have proof for that. Human genome, which has got deviated in the last 100 years, even the modern research says 99% of our genetics can be changed, which we call as nowadays epigenetics. तो क्या क्रोमोसोमल डिफेक्ट को ठीक करने का हमारे पास तरीका है? What do you say when you find a chromosomal defect? हम ठीक कर सकते हैं. We can do that. Can we stop the reason for PCOD, endometriosis? Can we reverse the reason for that? And that is what we have achieved. Can we improve the conception probability of females who are more than 40 years? We have been able to help a lady conceive at 52. Can we improve the chances of conception in cancer patients? There is a patient who came to us who was going through chemotherapy in January. She joined the program in April. Now she has conceived without assistance. With such wonderful result, if we collaborate with the assisted reproductive ecosystem, our practice of IVF can become pioneer and best in the world. But then we'll have to open up the horizon of our thought process. क्योंकि आप सोचते हैं जिस तरीके से उसको थोड़ा सा अगर हम फैलाव दे दें, we can become pioneers. And ultimately, what is our goal? To help human beings, to make human beings more fertile, to give this happiness of conception or reproduction to the humankind. यही तो है आखिरकार. So why we are not able to come to a certain point of agreement where with a little effort, just this missing part, if you fix this missing part, empowering human body, because human body is supposed to produce those hormones, isn't it? AMH count तो human body बढ़ाता है, उसकी जिम्मेदारी है. अगर इसको हम कर दें सही, we can become pioneers. And the time has come. डॉलर की वैल्यू खत्म हो रही है और इंडिया will rise, but then with its own thought process. कोई बाहर का thought process उधार में लिया thought process चलेगा नहीं. आपको ओपन अप करना पड़ेगा अपने आप को. Now, I'll introduce Kumbhak. What is it? So we'll do some experiment. And these are practical experiments that will help you to understand what is Kumbhak and how it can help the human being increase the fertility quotient. So, I'll explain Kumbhak in few ways. First, let us see how do we make effort. Let us see how do we make effort. So just clasp your fingers. सभी करें ना तो सबको समझ में आ जाए. You just clasp your fingers and try to pull hard. बहुत जोर से खींचेंगे और जोर से और जोर से और जोर से. How are you pulling? How are you pulling? ये पुलिंग का एफर्ट जो लग रहा है वो आप लगा कैसे रहे? Because most of you are from doctors fraternity. आप एक तरीके से सोचते हैं. So आप सोच रहे होंगे muscles, nervous system. Some people might be thinking mind and whatnot. But you are missing a point. ये point क्यों miss कर रहे हैं? Let's do it again. And wherever I'm indicating, just look there. आप दोबारा से करें and try to pull hard. Now put all your effort. Try to pull hard. Are you holding your breath? The more you try to pull hard, the harder you try to pull, the more you'll have to hold your breath, isn't it? And can we see it in another experiment? Just try to push and push hard. You again hold your breath. How do you lift weight? Weight कैसे आप उठाते हैं? You hold your breath and lift weight, isn't it? So walking, jogging, yoga, Zumba, aerobics, whatever you do, whatever action you do, how do you do that action? Singing, dancing, climbing staircases, how do you do that action? Any kind of action has a breath hold factor behind. Without breath hold, you cannot do any action. So, breath hold is the dynamic mechanics of life. इसको दो तीन तरीके से मैं आपको समझाऊंगा, and it is not very difficult to understand. The only thing is, it is not exoteric, it is esoteric. You'll have to look inwards. So without breath hold, you can't do any action. Now it also correlates with your organs. What we have found, and we do a lot of Kumbhak programs, and what we have found, that it improves the organ function. And that is why we have been able to achieve medicine-free life for people who are into heart disease, blood pressure, thyroid condition, diabetes, neuromusculoskeletal problems, and infertility. And our achievements are all on reports. So somebody asked outside, how do you make people believe? I don't. The reports do. The results do. Now, another way of looking at Kumbhak. According to the law of physics, there are two factors which is running the whole universe: pressure and temperature. Without pressure and temperature, nothing works. So pressure also creates temperature. Let's understand. A cloud has to move from one place to another. It will move in a pressure gradient from high pressure to low pressure. Water has to move upwards in a tree. It will go up in a pressure gradient from high pressure to low pressure. Anything in the body has to move. Even hormones has to be released. It will release in a pressure ecosystem. Every organ functions in a pressure ecosystem. Unexplained infertility, you know. What is unexplained in that? The pressure ecosystem is not okay, and you don't have any way to measure it. So, everything, any dynamic activity in the world happens in a pressure gradient. Pressure also creates higher temperature. That's why if you go up, pressure is low, temperature is low. Go down, pressure is high, temperature is high. In Ayurveda, this pressure is called as Vata. You must have heard about Vata, Pitta, Kapha. But even the Ayurvedic ecosystem has lost this aspect over the ages. This pressure is called as Vata, which is the king of Ayurveda. So, if the pressure ecosystem is not okay, the thermal ecosystem of the body will not be okay. So, correcting the pressure ecosystem will correct the thermal ecosystem along, which is called as Pitta. The metabolic factor of the humankind, the metabolic diseases are increasing in the world. The Vata Pitta, pressure, temperature, actually helps material management in your body. If this two ecosystem is not okay, pressure ecosystem and temperature ecosystem, thermal ecosystem, it is not okay, material management will not be okay. If material management will not be okay, forget about fertility. And how to improve the material management? You improve the pressure ecosystem and the thermal ecosystem. How do you improve the pressure ecosystem of this body? By breath hold. You can't do it any other way. There is no other way. Can you improve metabolism? Yes. Can you reduce the rate of heart attack in the world? Yes. But then you'll have to introduce this Kumbhak. You call it by any name. I have chosen to keep an ancient name to it because we already had this. Now there are experiments going on around the world. People are trying to live underwater in a pressure, and they found. And what do they found? And they find that within 100 days they can reduce their age by 10 years. That's what I have been saying. Kumbhak can actually reduce your biological age. 2 years of Kumbhak. I said 2 years, but experiments say in 100 days you can reduce 10 years. We have done the world's first experiment. We have done the world's first scientific experiment correlating Kumbhak with mitochondrial health. You know, every kind of function in your body has some correlation with mitochondria. Because mitochondria is the powerhouse of our body. It gives us the energy. Without energy, can anything happen in this body? Nothing. And you know, mitochondrial health has decreased over few decades. Now, I'm not trying to put down anybody. Give me one person who has come out of diabetes by reducing sugar level or taking medicine in the last 100 years. Give me one example. Diabetes is increasing in the world. Give me one example of a person who has come out of blood pressure, heart disease by taking medicine. So, I'm not saying those are not important, but those are reactive methodologies of treatment. When we can improve the ejection fraction, the heart rate, the rate of miscarriages, and that's what we have achieved. By doing Kumbhak, we can reduce the rate of miscarriages. The holding factor, heartbeat doesn't happen. And people come and do Kumbhak, and next time heartbeat happens. So even if we go for IVF, if we improve the efficiency of IVF or assisted reproduction, only then we are really helping the humanity. We are also becoming the pioneers in the world. We'll have to collaborate with that. We run program for preventing fertility also, Nirambika, just starting that program where we can enhance the fertility factor of people who go for marriage or conception at later stages of life. We run a program for conception where we have found these results, what I have just explained, by the name of Garbhadhana. We are doing program which can actually help prevent genetic disease from parents to the offsprings. We can prevent the genetic transfer. Do we need this at this point of time? Yes, very much we need that. So we run a program for that by the name of Ashtanga Garbha Sanskar. Now I've kept the ancient names because we already had those things, but I've created those methodologies and formulas. There is a lot to do. There is a lot of research that we are trying to do, but then a single person can't do everything. So if the whole ecosystem of fertility, they come together, all the stakeholders, if they come together, they collaborate and do research in a different way, in a different area, with a different thought process, we'll be able to help humanity for sure. And that is why I said we'll have to open up the horizon of thought process. So I'm just trying to take a little leverage of being a little harsh without introduction of Kumbhak and other ways of empowering the human body. There is no possible of improvement in the world. Fertility is going down. It will go down. Assistance will help to a certain level. Even if you try to preserve the embryo, the egg, AMH count you can't increase. What will be the use of those eggs? We'll also have to look from that perspective. And let's expand our horizon of thought process and collaborate and work so that we can improve the fundamental fertility of humankind. Thank you.